So hi everybody and welcome to Torc Talk, a series of interviews, and this month we're focusing on mental health because it's November, and today I'm delighted to be joined by Shane Dinham, who is a community mental health nurse with the HSE. So Shane, you're very welcome to Torc Talk.
Thanks, Derek. Great to be here.
Thanks for taking the time out to have the chats.
You're welcome.
So because it's Movember, which is the month where we focus on men's mental health, today we're going to talk about staying connected and how that's related to men's mental health. So Shane, can you tell us a little bit about your role in the community? You're working as a community mental health nurse. What does that mean every day?
Well, I'm a link between the services of consultant psychiatrists and the public. I work within the community. I cover the whole of South Kerry, which is quite rural and remote. I've been doing that for the last 15 years.
So when we talk about staying connected, what does that mean in the context of men's mental health? What does that mean?
It means that we're social beings by nature, and it's very important to stay connected with groups in activities and in the community. It helps to feel part of the community. It helps to alleviate loneliness that can lead on to depression and anxiety. Overall general well-being. It can improve cognitive function, maintain good memory and good mental sharpness.
Yeah, so not unlike us today, Shane, we're having the chat and we're talking about life and seeing what's going on outside of this video, and we have regular chats, and it's good to vent and give out about things as well, and that's really all part of what we're talking about.
Totally. Men seem to chat better shoulder to shoulder as opposed to face to face.
Yeah. Okay. That's an important point to note as well, isn't it? That men aren't the same as the female contingents within the community who like to have that chat face to face, but men are very much shoulder to shoulder.
Very much so.
Yeah. And if we recognise that, I suppose that can be staged in the community and in settings where men have that opportunity to talk shoulder to shoulder. I suppose the men's shed is a good example of that.
Perfect example of that. But even in general work practices, you'll always see it when you go out in social gatherings. The men there usually having a chat. It's not sort of like a one-to-one sort of thing.
Yeah. And is it better in your experience, men in general, I'm just thinking through my own experiences through life, but is it better when men are more connected when they're doing something, like if they're, I don't know, fishing, or again, the men's shed is a good example where they do a lot of woodwork. If they're active, are they more inclined to have the chat then? And
they can be, but it's also important to find an activity that you enjoy doing yourself.
Sure.
And staying active is very important for good mental health.
Okay, great. So Shane, look, I suppose what do you see as the main challenges or pressures that men face today when it comes to their mental health? What are the big things that are overarching and hanging over our male population in the Kerry area today?
Well, as I said, I cover the whole of South Kerry, and isolation is a huge thing. You've got the rural and remote areas of Kerry where they've limited resources.
Okay. And I know you deal primarily in South Kerry, and I suppose South Kerry could be mirrored in Galway or Donegal or areas of Cork and across the whole country.
Agreed.
But it's a huge issue, I suppose, in geographical areas, the nature of the country that it is. So you're saying the communities are actively identifying and maybe putting pieces in place that negate that rural isolation. Can you give some examples in South Kerry maybe of what's happening there?
Yeah, there's a great rural network in South Kerry developing, which is identifying sort of the isolation and the impact that it does have on men's mental health, and generally getting them into working with them to get into groups and have social activities and meetings.
Yeah, great.
So they're positive steps that are being taken.
Yeah. And I think South Kerry Development Partnership work really hard in that area at the moment, bringing farmers and rural communities together. I know there's a men's outing on a regular basis with the SKDP, primarily made up of South Kerry farmers who are somewhat isolated, and they have a great cohort together where they can speak and talk about whatever is in their head today. So that has to be a positive thing for them. Okay, so have you noticed any changes maybe in how men approach their mental health? Is there changes? I suppose historically speaking, we know that men aren't great at talking about mental health and is somewhat stigmatized for them all the time. Maybe again, the ladies of Kerry and beyond are probably better at seeking and talking about mental health issues, but men are very much, I think, still of the nature where they feel it's a vulnerability and they can't talk about it. Are you seeing any changes there? Are men in general opening up a little bit more about their mental health state?
I think there are subtle improvements in that area. I think one of the areas where it has improved is the fact that when men are having chats with their mates, etc., I think their mates are identifying it more so. And they're signposting or flagging things that they feel are slipping in their mates' lives that, they could help with, So
Okay.
I think that's important, that the community in whole is better educated and they're more aware of what's going on.
Okay. And what impact can isolation or disconnection have on men, especially those living alone under stress? So what does that look like, Shane? If we see somebody who's really struggled with their mental health, how do we see that in a man? What does he? Are they quieter? Are they stressed? Or what way does that look?
They generally become more withdrawn, and you could see changes in their routines. You mightn't see them as much. Certainly, their head goes down a little bit more. It could lead to anxiety and etc. and things like that.
So if we've kind of spoken briefly about the stigma that is probably still there, I would imagine, even though it is improving, I think, subtly, as you say. But what are some ways that we can continue to challenge that stigma that still presents for men and their mental health and that vulnerability? I think that they see it as against it just being another medical condition.
It's a process, I think. I think education's a huge thing. Even keeping things simple when you educate people with regards to the message you're trying to get out there. Access to services is huge, and resources that are in there. We need to spend money on appropriate services and supports in the rural communities so that it gives people options of what they can do. And also to getting back to the point of finding activities that, in the local communities that would benefit and break that isolation up.
And can you speak to us then, your work in the community, you're obviously working with individuals, but you're obviously, I would imagine that you're engaged also with their families. Can you talk to us about maybe the impact that friends and family can have with connections to the community as well, but particularly about family and friends? How can they have an impact on that person, and how can they change their outlook, I suppose, and ultimately have a positive effect on their mental health?
Yeah, they've got to look at it from the person's perspective, where they are, as opposed to from where they're coming from. You expecting them to do things is always difficult. Put yourself in their shoes and how they feel, where they would be. I think it's important to look at it from that perspective as well. But just to reassure them, a lot of reassurance, and say that, they're not alone. There are services there for them. And make themselves aware as a family, educate themselves on what they think's going on. And also speak to the relevant supports there,
Okay, and I suppose you make the point there that family members and friends, if they're going to have a positive impact on that person who's struggling, that they need to see it from the person's perspective and not necessarily what their own perspective would be. I'm assuming that can be very different, meaning I look at you're struggling with your mental health, and I think, well, what's wrong with him? He's driving a lovely car, he's got a great job, how could that be a struggle for him? Mm-hmm. Does that happen in the community where people misread maybe the struggles that somebody's having, and then they don't actually offer the help and assistance that they should?
That's definitely, in some aspects, definitely, yeah. In some cases, most definitely there, as you said yourself, there's a person there that's displaying an image of, maybe even positivity and strength, but they don't know what's going on behind the scenes.
Okay.
The people nearest and dearest to them may know.
Okay.
They see the real person.
Yeah, so a lot of empathy, I suppose, is what we're talking about there.
Yeah.
Okay, and do you think, just again from your work and what you've seen, do you think that age and culture, and a background, can that make a difference in people's lives? And do you see differences between the farming community versus the urban community in those areas? How does that look? What does that look like today in Kerry?
It's still very much so there. It's you do have that farming community that live on the land, and they are generally isolated
By the very nature of their work.
By the very nature, exactly. Yeah. But also too, they've done things the way, and it's a culturally and demographically. Whereas culturally, other cultures that are coming into
Ireland in general,
yeah, they view mental health differently. Some, and they manage it differently. Some wrap around as a family.
Okay.
Others are quick to put their hand up.
So can you give us simple, maybe everyday ways where men who are trying to look after mental health, whatever demographic they come from, are there simple ways where that can be nurtured and looked after? What do you suggest are the things that people need to do on a practical basis day to day?
Okay, I look at a routine is very important.
Okay.
Staying active is good for mental and physical health. You know, it can alleviate, as I said, loneliness by being connected in part of the community. Healthy diets, sleep. As simple as a little thing as a walk, staying active and things like that. But meeting up with families and friends can help you feel part of a community as well. And that can keep you connected in many ways.
So from that, you're telling me clearly that there's an awful lot that's in the control of the person in question. You know, talk about sleep and eating well and exercising, and those three elements alone are all within the control of the person. But I'm imagining if somebody's suffering with their mental health, that's actually a struggle. Those day-to-day pieces are probably a struggle.
They can be, yep, can definitely be. And that's where you need somebody to help support you.
So Shane, look, in your work every day, you know, are there simple things, I suppose, that sports clubs or community groups can do and involve themselves in to try and help to assist men in looking after their mental health and well-being? What do you think about that?
I think it's important to stay connected within the sporting groups, and if you are a member, you may not be an active member as such to participating in it, but you can volunteer and support the clubs in many ways. Any of the days that come up, you can volunteer to use, work the parking.
Sure, so marshal,
anything like
administration, I suppose, and those roles as well.
And that helps you stay connected within the community.
So Shane, if somebody's feeling isolated or low, men in particular, what's the first step they could take to try and change that for themselves?
Well, essentially their GP is their first port of call, really. The GP could signpost them to anything that they feel that may help them. It may be not so much an issue, it may be just a problem, or they need to get over something that could steer them towards a group or an activity that may help.
Okay. I'm thinking here in Torc, we've got a wonderful service, social prescribing, and it's about reconnection to community. It's a non-medical service, which is great. And it's just working at the person's pace, I suppose, and also meeting their needs at that point in time. So there are a lot of services out there. You'd agree with that, I think, would you?
Oh, totally. I've looked, just from my experience and from the job I do, I've worked closely with social prescribers, as you know yourself, Derek, and I found them invaluable. Mm-hmm. They're a fantastic resource that we do have, and I certainly do utilise it.
Yeah. So Shane, just to close off the interview, if you, from your experience within the community, if you could give one piece of advice to men about looking after their well-being and their mental health, what do you think that would be? What's the first step there that people can take?
I think it's to acknowledge that you need help and something's not right.
Okay.
And that's where you first reach out and you look to your family and significant others or supports close by, and try to wrap them around and just see how they can support you.
Yeah.
But acknowledging that you do need help is the first point of call.
Okay, and I'm assuming for a lot of people, not just to make it gender specific, but nonetheless, I'm assuming for men that is a huge step internally to say, okay, I've got a problem here and I need to seek some help. But is that how you see it in the community?
It's still very much like that. As I said, it may be more so with demographics, but as I said, there's probably been a subtle change, but it's still very much so, yeah.
Okay, and can I ask you one last question, Shane? Just, I suppose, we're probably talking about a cohort that are, middle-aged and older possibly, relative to the younger generations coming through. The schools have gotten better, the colleges have gotten better at promoting mental health and well-being. Do you think that's going to have a knock-on effect where we'll have, I suppose, maybe more determined or more resilient people as they grow through life, that things will be better for them in the future? How do you feel about that?
I think that's a positive. I agree with that. I think the schools is a great point of call, and you start there and you become more preventative than curative.
Okay. Shane, thank you. It's been great having the chat with you today. And we look forward to seeing you again soon. And hopefully this video will be posted on our social media pages and on our website. And we'd be delighted if you look at it and share it. And once again, thanks to Shane Dinham, Community Mental Health Nurse with the HSE. Thank you.
Thanks, Eric.